Good morning, everyone. I am Dr. Alvin Malik, Pediatric Medical Officer. I will be your moderator and consent companion for today's event. Before we begin, allow me to first to say good morning to everyone, to our event's resource speakers, to my fellow doctors who are virtually present today, and to all the netizens who are listening, watching today's activity. On behalf of the Nabota City Hospital and the Breastfeeding Committee, I would like to welcome everyone to today's informative event. August is declared as a World Breastfeeding Awareness Month with this year's theme, Protect Breastfeeding, a Shared Responsibility. As part of the celebration, the Breastfeeding Committee organized this educational and informative activity for all of us. Every one of us knows how beneficial breastfeeding is for the child, for the mother, for the family, and for the community as a whole. And every child born into this world deserves the benefits breastfeeding gives. As breastfeeding advocates, we envision a world in which every family is supported at every step along the infant feeding journey, especially now that we are facing one of the most challenging situations our health system has encountered, the COVID-19 pandemic. Protect breastfeeding, a shared responsibility, is about how breastfeeding contributes to the survival, health, and well-being of all, and therefore breastfeeding must continue amidst the challenging times. Protect, promote, and support. Our resource speakers will share their knowledge and expertise for us to know more about different topics on breastfeeding. Breastfeeding Month aims to raise awareness, the health and well-being outcomes of breastfeeding, and the importance of supporting mothers to breastfeed for as long as they wish. These practically protect, promote, and support breastfeeding. Our first speaker is a diplomate of the Philippine Obstetrics and Gynecological Society and a medical officer 3 at the Nabota City Hospital, Department of Obstetrics and Gynecology. Let us all welcome Dr. Arian Maris A. Onila.
Morning, everyone. I would just like to first check if you are able to see. Alright, to start off with, everyone, for this year's Breastfeeding Month, the WHO and WABA, or World Alliance for Breastfeeding Action, has chosen the theme Protect Breastfeeding, a shared responsibility. Alright, so before we try to discuss how the theme came to be, let us first reiterate and remember, why is breastfeeding so important? Lalo na para sa mga expecting na nanay, mga nanay na nakapanganak na, and for now, it's not really just the mother anymore. It's also for the society, family, and the whole community. Okay? Breastfeeding is the recommended, ideal, and most sustainable food for the healthy growth and development of infants and young children. That is why, in the hospital, early initiation of breastfeeding within 1 hour after birth is already being implemented. Kaya para sa mga nanay, pagkatapos yung mga anak, alam kong pagod na pagod sila, minsan, siyempre sa labor pa lamang, nalalagay na po namin yung inyong mga baby sa inyong sa may chest area para po mag-breastfeed na po sila agad. The WHO and UNICEF also promotes this by promoting eksklusibong pagbe-breastfeed sa loob ng 6 na buwan at 2 taon taas. Extended breastfeeding up to 2 years old and beyond is also being advocated. Now, what about complementary feeding? Yes, ito po yung sinasabi natin na yung mag-introduce na po tayo ng bukod sa breast milk, syempre pwede na po natin pakainin or magbigay sa isang baby ng iba pa pong pwede nating ipakain. It is appropriate at age 6 months and beyond. So it is safe, timely, adequate, and it should be properly fed. Ensure access to appropriate complementary foods. In example, use home and community-based technologies. So for example, pwede po yung kanin, mga mashed carrot, mashed na patatas, syempre, mga naturally occurring na mga pagkain pa rin ang mas preferred po na ibigay natin sa mga. That is why use locally available and culturally accepted. Use low-cost and industrialized processed foods if medyo na yung mga naturally available, hindi po siya kayang ma-provide for. So what are the advantages of breastfeeding for mommies? Mothers who breastfed their babies, for one, have lower risk of suffering from postpartum hemorrhage. Ano nga ba itong postpartum hemorrhage? Para sa mga nanay na nakikinig po ngayon, yan yung mga pagkatapos yung mga anak, minsan napapansin nyo, yung OB nyo po o yung nagpaanak po sa inyo, napapansin na medyo dinudugo po kayo. Kaya po nagbibigay naman po kami talaga ng gamot para maibsan ang ganitong pangyayari, pero minsan nangyayari po talaga ito. At ang pagbe-breastfeed ay isang way kung saan hindi po kayo duduguin. Kaya po napaka-importante na within 1 hour after birth, ilalagay na po namin agad kayo, yung baby nyo, sa inyong breast. Okay? Number 2 is that the mother can practice natural child spacing since breastfeeding helps in delaying ovulation. Ito yung dahilan ng lactation amenorrhea na pinopromote po natin karaniwan. Ito yung sinasabi natin na natural family planning method. As long as nakakapag-breastfeed kayo ng around 8 to 12 times at least sa isang araw sa inyong baby, hindi pa po kayo nireregla ng magmula ng pagkapanganak niyo, ay mabisa po ang lactation amenorrhea as a way of contraception, right? Number 3 is that, syempre, the baby has more time to bond with her mother. Kasi nga po, laging yung baby ay nandoon sa may chest ni mommy. Number 4 is that the mother has lower risk of having type 2 diabetes, breast cancer, and ovarian cancer. So marami po talagang benepisyo para sa mother. Maraming mga pwedeng maisan na mga sakit. Kaya kailangan mas maganda po talaga at isinusulong ang exclusive breastfeeding para sa nanay. Ang panglimang advantage po ay syempre, mura po at hindi po, libre po kasi ang breastfeeding. So kung tutuusin niyo po, wala po kayong binabayaran dyan. Kasi nga po, natural po yan na lumalabas po sa isang nanay. Ngayon, sinasabi po ng mga pagkapanganak na wala pong gatas minsan. Pero kahit papaano, isinusulong pa rin namin kasi ang pinakamagandang stimulant para po kayo ay mag-produce ng gatas ay breastfeeding pa rin. The mother has less likely to take absence from work also due to sick children. Kasi nga po sinabi po natin na ito pa lamang po ay napakasustansya. So mas mainam po ito para sa inyong mga anak. Kaya po kung masustansya po siya at nabibigay natin, mas makakabuti po ito para hindi po siya magkakasakit. At panghuli po, allow themselves to return back to their pre-pregnancy weight and shed off weight gain during pregnancy. Siyempre, maibabalik po natin yung hukog ng yung katawan bago pa po kayo manganak. Pero hindi po ito pwedeng gawin na parang ito na po ang magiging diet program ni ma'am. Okay? Kailangan po kahit papaano together with the proper diet, exercise, kahit papaano together with breastfeeding, yan po ma-achieve natin ang dati niyong pangangatawan. Okay? So hindi lang naman po para kay mommy ang advantages ng exclusive breastfeeding. There are also advantages of breastfeeding for babies. One, it is a complete source of nutrients including water for an infant. So hindi po naman kailangan natin magbigay ng tubig as long as properly and well breastfed po ang inyong anak. It can easily be digested. It protects the babies from infections such as pneumonia and diarrhea. It shields the babies from allergies. And it protects babies from diseases such as diabetes, ulcerative colitis, and even meningitis. So yung importance na maibsan yung mga ganitong mga sakit, kasi syempre, bata pa lamang sila. We need to give them the necessary protection para kahit papaano magkaroon sila ng pananggalang sa mga ganitong kasakitan. It helps in baby's brain and cognitive development also. Kaya napakaraming nutrisyon talagang nakukuha pa lamang sa breastfeeding. So pumunta na po tayo sa why do we need to protect breastfeeding and how the theme of the WHO right now in celebration for the breastfeeding month na protect breastfeeding as a shared responsibility. Sino ang kasama natin? Paano naging shared responsibility? At bakit kailangan siyang shared responsibility? So about the campaign, the theme highlights the links between breastfeeding and survival, health and well-being of women, children, and even nations. WABA states that this year's objectives are to inform people about the importance of protecting breastfeeding, anchoring breastfeeding support as a vital public health responsibility, and engage with individuals and organizations for greater impact. Number 4 is to galvanize action on protecting breastfeeding to improve public health. Itong ginagawa natin ngayon na isang webinar ay para sa lahat ng mga nanay, mga magiging nanay, sa mga partners, husband, the community who is also watching. This is for you to inform everyone, maging knowledgeable about the benefits of exclusive breastfeeding and how you can play a role in trying to protect breastfeeding. All of these objectives are all achieved in this type of platform, especially now, in the time of the COVID pandemic. The key to successful breastfeeding is that mothers are empowered to feed their babies anytime, anywhere, which means they need broad-based support across society. But the reality is, mothers can face significant roadblocks to breastfeeding their babies even when there is delicate process that goes well for them after the birth of their baby. The past reality is that breastfeeding was only the responsibility of the mother. Totoo ito, ma'am. Diba po? Dati, ang akala natin, ang nililecturean lang namin, mga nanay lamang. Kasi syempre, sila talaga yung may responsibility, mga techniques kung paano tamang pagbe-breastfeed, paanong mga oras, at saka yung mga posisyon. But now, the present reality, it is a shared responsibility. And the next question would be is actually, paano siya nagiging shared responsibility? Kasi many women do not breastfeed as long as they would like anymore. To make breastfeeding work, according to some women, trained health workers or providers should provide breastfeeding counseling during pregnancy at birth for the next 2 years. Ito ang dahilan na as an obstetrician, initially pagkalabas ko pa lamang po ng baby, syempre, pinopromote na po agad namin ang breastfeeding. Unang yakap, EINC, lahat po yan, binibigay na po natin, especially pagkapanganak pa lamang. The paid time off of breastfeeding or providing breast milk after returning to work, together with adequate paid parental leave after the birth of a baby is already implemented dito sa Pilipinas. Kaya nga po may mga maternity leave na po. Okay? And investment in breastfeeding support programs, syempre, yan po ang isa sa gobyerno natin, ang pagkakaroon ng mga check and balance with mother-baby friendly hospitals and partners and families to support and encourage the breastfeeding mother. And protection, of course, from formula marketing that undermines the confidence of breastfeeding. Who does the breastfeeding mother share the responsibility with? Eto, nag-viral to halos ng mga nag-post na alala niyo siguro nung si Billy Crawford nagkaroon ng post tungkol sa kanyang wife na si Colleen Garcia na he admires yung kanyang wife para sa pagkakaroon ng pagiging talagang adamant towards breastfeeding. When a partner is supportive, mothers are more likely to breastfeed, particularly if they act as their advocate and she experiences difficulties. So, emotionally, ito yung magiging role ng mga partners, husbands, even yung mga parents, na kapag medyo nalulumbay si nanay, mga pagdili-dali when it comes to breastfeeding, tulungan natin sila emotionally para kahit papaano alam nila at alam nilang may support sila, the family, from the partner, and even more from the community. Dahil not only is the breastfeeding now from the support is coming from the family. Right now, it is coming from health facilities. So initially, pagkapanganak pa lamang, meron na yan. Ibigyan na namin sila ng mga reinforcement na to please try to breastfeed. Kahit walang lumalabas, i-stimulate yan, proper positioning at yung latching with the mother. So sa hospital pa lang, meron na po kaming mga milk code, may mga standards and guidelines towards promoting a mother-baby friendly hospital. And then when the mother is discharged into the family or into the community, syempre, to get yung may mga role na dito ay mismo yung mga family at syempre yung mga partner, moral support na yung mga kailangan natin dyan. And of course, when the patient goes back into the working place, may mga batas na rin tayo na kailangan sa workplace, meron na rin pong nakalagay na mga lugar kung saan yung mga nanay ay maaaring makapag-express ng milk para kahit papaano maiuuwi nila ito sa kanilang mga anak. Ito ay napaka-importante, lalo na para sa mga pasyente na mga nagtatrabaho ang mga nanay. Okay? Siyempre, yung first 100 days ng leave, may chance po talaga na babalik na rin po yung nanay para at least magtrabaho. And this is also implemented in the industry, all right? Sa schools, syempre, yung mga ngayon pa lamang ini-enrich na rin yung mga estudyante as to the laws itself on the proper breastfeeding and also on the laws of exclusive breastfeeding and its benefits. So why do we need to protect breastfeeding per se? We each must do our part to support, promote, and protect breastfeeding as a national asset. Because in reality po, it may sound cliche, but indeed, the children is our future. They are the assets that we need to take care of. And we are making a promise to better equip them to reach their full potential, and we believe that it starts with proper nutrition for breastfeeding. Thank you, everyone.
Nakikita na po?
Yes po, Doc.
Yes, Doktora.
Good morning. For today's topic on monitoring the implementation on the Philippine Milk Code and the other laws. The objective is to discuss the effect of marketing on infant feeding, outline the key points of EO 51 and its revised IRR, describe the action health workers can take to protect families from marketing or breast milk substitutes, outline the care needed with donations of breast milk substitute in emergency situation, discuss how to respond to marketing practices, discuss the national IYCF policy and revitalization of mother-baby friendly hospital initiative, and outline the key points of RA 10-028 as it relates to NBFHI. So the Milk Code, or EO 51, intends to intensify and disseminate information on breastfeeding and proper nutrition, regulating the advertising, marketing, and promoting breast milk substitute and other products, including feeding bottle and teats. So the highlight of Milk Code, this regulates advertising and promotion of covered products, no sampling and gifts of any sort, no points of sale or advertising, giving of samples or any product devices to induce sales or donations. So hindi tayo pwede yung di ba, years before nung hindi pa yung may mother-baby friendly ito or EO, yung milk code natin, di ba ibang milk companies, nag-donate sila ng mga formula milks, ngayon hindi na pwede yan. Or any gifts of any sort, including yung mga ball pens, yung mga mugs, na may pangalan na ng formula milk. So another highlight will be the healthcare system will not to be used for promotion, however, allows dissemination of info for health professional. Scientific factual sa mga researches po ito. There should be no displays of products or poster in the health facilities, including calendars, ball pens, or yung mga mugs. No financial or maternal inducements to health workers except assist in research, scholarship, or continuing education. Then it should be labeled subject to approval of BFAD. Now, what is the revised IRR? It is an advertising, promotion, and sponsorship needs to be reviewed. Ito yung sa part na implementation na ng EO 51. Information of the hazards of breast milk substitute and supplements, sponsorship of researches subject to approval. There should be a labeling guidelines. The industry should not be a part of policy making and no products or gifts of any sort. So, dito, it's the aim of the milk EO 51 is to protect and promote safe and adequate nutrition in infants and young children through the promotion and protection of breastfeeding. Ang scope po ito is all products for infant and young child feeding that are promoted and marketed in a way that may undermine breastfeeding. So here, in other words, the milk code will state that breastfeeding is still best for the baby. And here it will, the scope is that anything na, diba, no to bottle feeds, no to, yung halimbawa, yung sa commercial, diba 0 to 6 months, dapat exclusive breastfeeding, no water, no ano. So, kahasakop dito, halimbawa, mayroong isang product, water product, or yung mga distilled water na nagsasabi na this water is best for the baby or panghalo sa milk. That is still sakop ng milk code. So what are the areas covered by the milk code? The information and dissemination, mothers and general public, healthcare system, health workers, the container and labels, the quality and the implementation and monitoring. So what is the do's and don'ts of the milk code? So sa do's, we support and promote breastfeeding initiation during the first hour after birth, support and promote exclusive breastfeeding for the 6 months of life of the infants, and thereafter support and promote continued breastfeeding with the introduction of complementary foods for 2 years and beyond. What are the don'ts? Do not request, accept gifts from the milk company's representatives. Ito yung sponsor. Do not request, accept, or mga products covered by the milk code and to the milk companies and their representative. And do not allow the milk companies and their representative to support or conduct activities in your communities, barangays, and cities. So in other words, we have to encourage every mother to breastfeed. Another do's and don'ts of the milk code. For the do's, always provide our mothers and pregnant women with correct information in relation to breastfeeding. This is what we are doing. During the pre-pandemic, we are also doing yung mga health teachings sa OPD, sa ward natin. Although today, we are still doing it, pero medyo modified na through webinars, through informatics, one-on-one with the patient, to spread yung correct information in relation to breastfeeding. Kasi marami dyan yung mga nasa TV, nasa advertisement, nadadala tayo pag paborito nating mga artista, pero medyo misleading sila. So we are here to provide or to remind everybody na breastfeeding is still best for the baby. So another do's, always suggest mothers that are encountering infant feeding problems and are planning to stop breastfeeding to get assistance from the nearest health centers. May mga dito yung mga may nagtuturo ng lactation, or you can consult or yung mga nag-health teaching, you can ask them, medyo mahirap po ako magpadede or parang konti yung milk. So they can give you an advice. So what are the don'ts? Do not promote products covered by the milk code. Do not allow milk companies and their representatives to promote their products within your health center, clinic, hospital, community, and barangays. Do not post or accept posters or other promotional materials from milk companies and use it in your health center, clinic, hospital, health facilities. Do not get sponsorship from milk companies and their representative without requesting the permission from the FDA. So, the code prohibits donations of products covered during emergencies. So maski on emergency tayo, the best ano pa rin is breast milk. The Philippines is a disaster-prone country considering that we experience almost all forms of calamities such as typhoon, earthquake, flood, volcanic eruption, landslide, tidal wave, fire, and armed conflict. It is a high risk. There's a high risk of artificial feeding because during emergency and disaster, because diba may typhoon, may catastrophe, may lindol, walang may flash flood, diba we lack water or source of safe water, cooking utensil or inadequate, there is a shortage of fuel. So in other words, halimbawa kung nagpo-formula milk ka, are you sure that it is clean yung water mo? Yung preparation mo, how can you prepare yung tamang preparation for sa pagpapadede sa bata? So still, pinaka-economical and pinaka-madali is still your breast milk. Diba? So another is the daily survival activities take more time and energy. There's uncertain, unsustainable supplies of breast milk substitute. So, sa mother, as in times of emergency, as long as continuous ang breastfeeding mo, continuous ang supply ng breast milk mo. Unlike yung mga nagpo-formula milk, o pag naubos na in times of emergency, catastrophe, saan ka nakukuha. So, kung breast milk or breastfeeding, mas pag dire-diretso ka breastfeed, mas marami kang milk na ilalabas. Then, next, the lack of knowledge and preparation and use of breast milk substitute. This makes our children to be more vulnerable in times of emergencies. So we have Administrative Order number 2007 or -0017, Guidelines on Acceptance and Processing of Foreign and Local Donations During Emergency and Disaster. Infant formula, breast milk substitute, feeding bottles, artificial nipples, and teats shall not be an item for donation. There should be no acceptance of donations shall be issued for any of the enumerated items above. So kahit in times of emergency, hindi yan yung mga dapat na a-acceptin natin na donation. We still encourage mother to breastfeed. Tapos, the IYCF guidelines during emergencies, initiate breastfeeding within the first hour. I know it's paulit-ulit, but this is the basic that we have to know, that we initiate breastfeeding within the first hour, exclusive breastfeeding from 0 to 6 months, no water, no vitamins, no other juices except breast milk. Continue breastfeeding up to 2 years and beyond with addition of complementary food starting at 6 months. So here, I know Dr. Onila have shown these slides. So this is the IYCF plan of actions. This will tell you how the monitoring and implementations and with ng mga laws natin. So the coverage is the health facilities, the family, working place, industry, and schools. Sa health facilities, there's the Mother Baby Friendly Hospital Initiative, the enforcement of milk code, and RA 1028. Soon, later in the slides will pass. the IYCF standards and guidelines, IYCF in malnutrition and special medical condition, and infant feeding in emergency. Then, so dito yung, di ba, sa hospital, sa health facilities, we encourage mother na exclusive breastfeeding, hindi tayo nagpapapayag na magpasok ng formula milk unless medically indicated, no nipples, yung bottle feeding. Kung talagang kailangan, we do the cup feeding if it really necessitates. Okay? Next is the in family. Included din yung mga family and community, the peer counseling in barangays, enforcement of the RA 1028, IYCF malnutrition special. It is a malnutrition which will be tackled also by another resource speaker later on. So here, sa working place, enforcement of RA 1028, yung lactation rooms and breastfeeding enforcement of milk. Sa Navotas, we have one at the 3rd floor near the delivery room. Okay, so in industry, compliance of the Milk Code and Consumers Act, compliance to Codex Code for hygienic process of foods and infants and children. And for the school, ine-encourage na ito yung IYCF practice to be integrated into a curriculum para as a mother baby friendly school. So you can see the how we protect breastfeeding sa Philippines is that hindi lang hospital ang kasama, it is the whole group. It's the whole community and iba pa areas, the school, the industry, the working place, the health facilities, and syempre the core is the family. So makikita nyo po na breastfeeding, that's why it's breastfeeding is a shared responsibility. It's not only by the family, it's not by only health workers, but everybody in the community. Next. For Administrative Order number 2007-00026, revitalization of the Mother Baby Friendly Hospital Initiative and health facilities with maternity and newborn care services. The objective here is that all health institutions with maternity and newborn care services to protect, promote, and support rooming in Mother Baby Friendly Hospital Initiative practices. They build the critical capacity and commitment of healthcare staff in protecting and providing support for appropriate IYCF practices and establish linkage with primary healthcare facilities and community support. So the implementing mechanism for this is the mother-friendly steps to mother-friendly safe motherhood initiative and the 10 steps to successful breastfeeding. Yan yung nakikita nyo sa mga lobbies po, actually sa lobbies din sa mga lobbies po ng hospital. So this, wag po baliwalain, kindly give time to read the 10 steps to successful breastfeeding po. And if yung 10 steps to successful breastfeeding, if we are able to do it or follow it, we are on the right track to a successful breastfeeding, to successful breastfeeding. So, Administrative Order 2009-0025, adopting new policies and protocol on essential newborn care. This is an evidence-based essential newborn care roles and responsibilities of different DOH offices and other agencies in the implementation of the protocol. This is ensure quality provision of time-bound intervention. Unang yakan. And now, for RA 1028 and mother-baby friendly workplace. RA 1028 was passed into the law in December 2009 and signed by the former President Gloria Macapagal Arroyo in March 16, 2010. An act expanding the promotion of breastfeeding, amending for the purpose Republic Act numbers 7600, other known as an act providing incentives to all government and private health institutions with rooming in and breastfeeding practices and for other purposes. This act shall also be known as the Expanded Breastfeeding Promotion Act of 2009. The provision here is that lactation station in every private enterprises, government agency, government-owned and controlled corporation. So you can see here that not only to our hospitals, which is located sa third floor, but you can also see lactation stations sa other hospitals, sa malls, sa mga private companies or government agencies. So they have also the lactation periods. Lactation periods for breastfeeding employees in addition to time off for meals to allow them to express their breast milk. So yung mga employees na pwede sila mag-express breast milk or may time silang, may allowable time na given sila during that time. Breast milk banks in the health institution to store pasteurized breast milk donated by breastfeeding mothers. Yes, may mga malalaking ibang hospital sa tayo may breast milk banks. And inclusion of breastfeed in the curriculum of the school. So, pati school, ini-include nito as part of their curriculum or in a subject. So again, to summarize up the highlights of the Expanded Breastfeeding Promotion Act of 2009, RA 1028, the areas covered would be the health facilities, workplace, schools, public places, and public. For RA number 7600 or the Rooming In and Breastfeeding Act of 1992, an act providing an incentives to all government and private health institutions with rooming in and breastfeeding practices and for other purposes. The law is in promotion of the state policy to encourage the practice of breastfeeding in the Philippines. It composes of 14 sections divided into 4 chapters. For Sec 2, a declaration of the policy, the state adopts rooming in as a national policy to encourage, protect, and support the practice of breastfeeding. It shall create an environment where the basic physical, emotional, and psychological needs of mothers and infants are fulfilled. Ito yung, di ba right after mga anak, ilinalatch na with the mother. Before the mga, dati, they stay in the, yung wala pa ito mga laws na ito, they stay in a NICU or they were separated from a mother. Ngayon, they are together with the mother within 24 hours kung as long as walang medical condition, they are roomed in with the mother na. So, anong advantage nito? Physical, emotional, psychological. Why do we say this? One is there will be a bonding between the mother and the baby. The mother will know the cues when the baby wants to parang ito yung get to know each other. Yung mga cues when the baby wants to feed or makikilala niya si baby. Plus, there's the emotional attachment to both the mommy and the baby. Okay? So next, and lastly, the first 1,000-day bill is now a law. The Republic Act 11148, Kalusugan at Nutrisyon ng Magnanay Act, signed by President Rodrigo Duterte on November 29, 2008. The law seeks to scale up the national and local health and nutrition programs through strengthened integrated strategy for maternal, neonatal, child, and nutrition in the first 1,000 days of life. This will be also one of our speakers, Sir Florito, will be discussing first 1,000 days in association with the breastfeeding. So, in summary, we have laws and laws that we follow to protect breastfeeding and to protect, promote, and support breastfeeding. And this will also answer why it is a shared responsibilities because it hindi lang to sa family, hindi lang ito sa hospital, but the working place, industries, and also schools, we are already incorporating and doing to strengthen yung breastfeeding program sa Philippines. So, for my parting words, if a new vaccine became available and that could prevent 1 million or more child deaths a year and that was moreover cheap safe administered orally, and required no cold chain, it would become an immediate public health imperative. Breastfeeding can do all this more. Thank you.
To proceed, the COVID-19 pandemic is disrupting normal life globally. Every area of life is touched, and breastfeeding is not spared. To talk on breastfeeding during COVID-19 pandemic is a diplomate of the Philippine Pediatric Society and also a pediatric medical officer 3 at the Navota City Hospital. May I call on Dr. Maricel J. Castillo Perez to share her knowledge about the lecture. Dr. Castillo.
Magandang umaga po sa ating mga tagapakinig. Thank you so much, Doc Alvin Madrid. The benefits of breastfeeding and the mother-infant interaction to promote health are especially important when health and other community services are disrupted or limited. Ngayong umaga po, we will examine kung ano po yung mga evidence na meron kung talaga po bang naipapasa po sa breastfeeding or sa breast milk ang COVID virus. So we have a lot of information delivered ngayong umaga about the importance of breastfeeding. No? So breastfeeding is the cornerstone of infant and young child survival, nutrition, and development. Not only para sa bata, but it also promotes maternal health. And breastfeeding, early uninterrupted skin-to-skin contact, rooming in, and kangaroo mother care significantly improve neonatal survival and reduce morbidity, and are all recommended by WHO. Okay? So, here are some of the diseases or mga illnesses na nape-prevent kapag po tayo ay nagpapasuso sa ating mga anak. And I would like to highlight that among the breast milk composition, itong mga antibodies po na tinatawag natin ang responsible to protect our infant against numerous infections, hindi lang po COVID, and ultimately death. Some studies also show that their IgA antibodies with reactivity to COVID-19 have been detected in breast milk of mothers previously infected with COVID-19. Kaya lang sa ngayon, hindi pa sapat yung mga naging pag-aaral para masabi yung strength and durability nitong mga antibody na nakita natin. So ngayon, nagkaroon tayo ng pandemic. Ang tanong ng mga nanay, Dok, pwede pa rin ba akong magpadede kahit na COVID suspect ako or COVID confirmed ako? So, tutunghayan natin yan ngayon. SARS-CoV-2 is the novel coronavirus that causes the COVID-19 disease. So, ang mga known mode of transmission kung paano tayo nahahawa is, of course, number 1, inhalation of infected respiratory droplets or aerosols. And secondly, direct contact to eyes, nose, or mouth. Most of the infection occur in older population, including pregnant women. And on the other hand, COVID-19 is uncommon sa newborn. Even yung mga newborn na pinanganak sa nag-positive na COVID-19 na mommy. Some newborns also test positive shortly after birth, pero hindi ito hindi sigurado kung paano pa nila nakuha yung virus, either before, during, or even after birth kapag na-expose na po sa ibang tao. And apart from the rare cases na may mga severe cases ng COVID, most newborns who tested positive have mild or no symptoms at all. Up to date, active COVID-19 has not been detected in the breast milk of any mother with confirmed or suspected COVID-19. There is no evidence supporting intrauterine or transplacental transmission from infected pregnant women to their fetuses. So good news po mga mami, hindi po tayo dapat mag-alala sa ngayon dahil ang mga current data, although patuloy pa rin ang pagsasaliksik ng mga eksperto, hindi pa ho na-detect sa breast milk ng nanay na nag-positive o kahit na suspected COVID ang virus. At hindi ito mahahawa sa inyong mga anak pag kayo po ay nagpa-breastfeed. So, WHO recommends Mothers with suspected or confirmed COVID-19 should be encouraged to breastfeed, and mothers should be counseled that benefits of breastfeeding substantially outweigh the potential risk for transmission. Okay? So with the little information that we have about SARS-CoV-2 virus versus the vast knowledge of the benefits of breastfeeding, plus the general infection prevention measures, our experts from the CDC and World Health Organization gave us guidance in breastfeeding in the context of COVID-19. So first, if the mother is a suspected or confirmed case of COVID-19 and is well enough to breastfeed, support mother to breastfeed. So tuloy lang po ang pagpapadede. So do not separate mother and baby. Very important yun, yung early skin-to-skin contact natin and thermoregulation. But during this contact, syempre less than 6 feet away kayo from your baby, we advise the mother to wear a mask during breastfeeding, to wash hand with soap and water before and after touching the baby, and to wipe and disinfect surfaces regularly. So yung washing of hands, may I reiterate, dapat ito ay 20 seconds duration. Tapos, if hindi po available sa area ninyo ang soap and water, pwede rin po ang 60% alcohol. So, pinapayagan po yan. Secondly, if unable naman to directly breastfeed, for example, talagang may iniinda yung nanay, and the mother is able to express breast milk, then we have to feed mother's express breast milk to the baby. So, pwede tayong gumamit dito ng clean cup or cup and spoon when feeding the baby. So, kagagaling lang natin sa mga laws, bawal po ang bottle feeding sa ating baby kasi mako-confuse ho sila kapag ka po yung ibang nipple na yung pinagamit nyo sa kanya. By the time you want to resume yung direct breastfeeding, hindi na po kilala ni baby yung nipple ng mommy. So, to prevent that, we use clean cup or clean cup and spoon when feeding the baby. Then we have to clean and sanitize breast pumps and all infants feeding items. If available, there should be when needed, dapat ang mag-a-assist po is healthy and low-risk caregiver. Siyempre, dapat hindi siya na-expose sa COVID. And revert to direct breastfeeding when mother is well enough to breastfeed. Again, if hindi naman kaya rin mag-express ng breast milk, pero may available na human milk from a donor human milk bank, then we have to feed the baby with the donor human milk until the mother recovers. So, importante po ito yung pasteurization. No? Pasteurized donor human milk is important in the care, especially of pregnant infants. And studies show that pasteurization also inactivates SARS-CoV-2. So, pwedeng-pwede po yan. And if wet nursing is culturally acceptable and a safe wet nurse can be identified, facilitate wet nursing of the baby until the mother recovers. Dok, ano po yung wet nurse na sinasabi? So, ito po yung ibang nanay na nagpapasuso kay baby. For example, talagang ang mommy, talagang nagkaroon ng severe case ng COVID or meron siyang ibang iniinda na hindi na talaga kayang mag-express ng milk, or for example, yung donor milk ay hindi rin available, depende sa pag-accept ng nanay and ng family kung pwede pong may magpadeding ibang nanay para sa kanilang baby. That is still superior than giving formula milk po sa inyong mga baby. And then, after the mother recovers, we should assist mother with relactation when she is well enough to breastfeed. Isolation and quarantine. So, infants born to mother with confirmed COVID-19 are considered close contacts of the mother. And these babies should be quarantined for the duration of lactating parents' recommended period of isolation and quarantine. Meron lang slight na pagkakaiba ho yung term na isolation and quarantine. Pag sinabi ho kasi nating isolation, this is for people who are sick. So mothers with confirmed COVID-19 infection. However, pag sinabi mong, quarantine lang, ibig sabihin, hindi po kayo confirmed COVID-19 positive, but maaari kayong na-expose, so kayo po i-quarantine to prevent also the spread of infection. So yun lang po yung pagkakaiba ng isolation and quarantine. Isolation for the sick person and quarantine for the non-sick person. So, pag ganito po yung mga situation natin, we highly advise to stay home or stay in the isolation facility kung saan po kayo qualified, and stay away from other household members who are not infected, to have a healthy caregiver, if possible, who is not an increased risk for severe illness, and other household members who have COVID-19 should isolate and avoid caring for the newborn to prevent transmission. Lactation services. Ito, pinaka-importante rin po ito ngayon. Lack of access to professional lactation support is a barrier to breastfeeding. Access to this support is very critical during the COVID-19 pandemic. And breastfeeding issues are often urgent and requires assistance. For example, ang daming tanong ng mga mami, Dok, wala pong gatas. Dok, tama po ba itong pagpapadede ko? Tama po ba itong position na to sa pagpapadede na to? Or enough po kaya yung nadidede ng baby ko? So, minsan, ang dami pong agam-agam or mga questions ng mami. So, pinaka-importante po nito, sila ay may makausap na specialist. If wala pong identified na lactation professional sa inyong lugar, maaari po kayong lumapit sa inyong mga doktor na OB, pedia, at midwife. They are trained to give you support and encouragement kung paano ganda ang inyong pagpapasuso kay baby. Sa ngayon, sa mga panahon na hindi po possible ang face-to-face interaction, may alternative approach po tayo via our telemedicine avenue sa ating hospital. Breastfeeding and expressing milk in workplace. So, ganun pa rin. We should wear masks. We should wash our hands and watch our distance with other person using the breastfeeding area. So, the area should be a private, non-bathroom space. And there should be physical distancing also dun sa area. So, dapat ma-maintain yung 6 feet apart na distansya. They may use physical barriers or shields. And pwede rin magkaroon kayo ng alternating schedule kung sino man sa inyo ang mga mommy na mag-express ng milk para sa kanilang baby. Allowed po yan dahil nasa batas na rin po yan, kagaya ng sinabi ni Dr. Puna. Then, we highlight the proper disinfection of breast pumps and surfaces. And hanggat maaari, gumamit po tayo ng personal nating breast pump. Alright, so to keep your baby safe and healthy during pandemic, so paulit-ulit po, to wear mask, dapat yung proper fitting mask for your respiratory hygiene, to wash hands properly, to wipe and disinfect commonly used surfaces. And ang mga baby and infant, hindi po silang nilalagyan ng face mask at face shield pag less than 2 years old because of the fear of suffocation. Then, sa ngayon, we should limit visitors to see your new baby. Siyempre, pag bagong panganak, ang daming gustong bumate, ang daming gustong pumarga, kumurot. Naku, wag niyo munang ipapakarga ang inyong mga anak hanggat hindi pa ho safe. Then, we should keep distance between your baby and people who do not live in your household, especially people who are sick. We should know also the possible signs and symptoms of COVID-19 infection among babies. So, nasabi na natin kanina na mild lang ito and usually mimics other infection. No? However, we should take note of fever, lethargy, yung parang walang gana ni baby, runny nose, cough, vomiting, diarrhea, poor feeding, increased work of breathing, or even shallow breathing. So aside from this, we should also encourage mothers to attend newborn visits. So either via coordinated face-to-face OPD consults or via telemedicine. Ensure safe sleep for your baby. So baka madagan na naman pagkatabi niyo si baby. Then mga mommy, you should ensure also your own social, emotional, and mental health. So baka mamaya, after mga anak, nadi-depress na kayo, may mga postpartum depression, please call your a professional help. So, contact po tayo ng doktor at mag-usap po tayo. Alright, so For the take-home messages, at present, data are not enough to conclude vertical transmission of COVID-19 through breastfeeding. Breastfeeding is the best nutrition and the best protective measure available for healthy and at-risk infants during COVID-19 pandemic. And basic adherence to infection, prevention, and control measures is essential to prevent contact transmission of COVID-19. Let us watch this short clip from the
WHO recommends that all women should be supported to breastfeed. If COVID-19 is suspected or confirmed, these hygiene measures can help protect the baby. Washing your hands before breastfeeding, coughing or sneezing into a tissue, and disposing of it immediately. Cleaning and disinfecting surfaces you have touched. Wearing a mask where possible. If a mask is not available, WHO still recommends breastfeeding, as benefits outweigh the potential risk of transmitting the virus.
Alright? So with that, let us all promote, protect, and support breastfeeding. Maraming salamat po sa inyong pakikinig.
Maraming salamat, Dr. Castillo Perez, for that very detailed lecture regarding the breastfeeding amidst the pandemic. So, Doktora, may isa lang question dito from L. Vetter Ana. Tanong niya, hello po, good morning po. Kung walang milk po, paano po mag-breastfeed?
Sa ano na yan, Doc Malik, no? Marami tayong bago yung tanong na yan. I mean, hindi po bago yung tanong na yan sa atin ng mga mami. So, una, siguro kailangan natin tanungin kay ma'am kung kailan po ba siya nanganak at po ba ay nag-try mag-breastfeeding nung siya ay nanganak. And we could teach her ng mga mga ways kung paano natin ma-relactate, ma-restart yung lactation para sa kanyang anak. Sa susunod na mga session, mapag-uusapan natin yung mga support or pwedeng mga diet para mas magdumami yung ating milk production. O re-refer natin siya sa lactation specialist. Pero tayo rin yun, Doc Mali. So,
pero in addition to that, siguro yung positioning din ng while breastfeeding, pwede hindi rin tama. So, tayo din pala yun. So, mag-telemed po kayo sa amin.
Mag-usap po tayo.
Mag-usap po tayo. Maraming salamat, Dr. Maricel Castillo Perez. So, remind ko lang po yung may mga questions, you can type it in our chat box para mabigyan namin ng kasagutan yung mga tanong nyo. So, we all know na that the importance of breastfeeding as a highly beneficial public health intervention for mothers and children on the first 1,000 days. It has been given an emphasis from one of the DOH current programs. So the DOH, by the way, leads the celebration of the National Breastfeeding Awareness Month this August 2021 with the theme Tulong-Tulong sa Pagpapasuso sa First 1,000 Days. So to tell us more about this a public health nutritionist dietitian from the Bota City Nutrition Office, let us all welcome Mr. Florito Y. Biduya II. Good morning, sir.
Hello, good morning. Good morning, Doc. Good morning, everyone. And so to start my topic, so let me share my screen. Yan. And so okay na. Wait lang po nag-share na po ba yung screen ko, Doc?
Nag-share na, sir.
Sa akin hindi siya lumalabas. Ulitin ko lang po ulit, Doc.
Okay, sir.
Mhm. Yan. Okay na po ba, Doc?
Okay na po.
Yan. So good morning po everyone. And so National Breastfeeding Awareness Month. Yan, ito ay ginaganap tuwing buwan ng Agosto. Yan, so may tema po tayo na tulong-tulong sa pagpapasuso sa first 1,000 days. Yan, katuwang po ng City Government of Navotas, National Nutrition Council, Department of Health, Navotas Hospital, and Navotas Nutrition Office. Yan. So, ano nga po ba yung first 1,000 days life? Yan. So, nabanggit po kanina ni Dr. Pua na meron tayong batas na patungkol sa first 1,000 days of life. Yan. So, sa first 1,000 days of life, nahati po ito sa tatlo. Ang unang part, 270 days para sa pagbubuntis ni Mami. Yan. So, pangalawang part po, yung 180 days po natin, para po ito sa younger stage of infancy from birth to 5 months. Yan. So, dito po nag-start na yung ating breastfeeding o yung exclusive breastfeeding po natin. Yan. So, yung last part naman po natin, natitirang 550 days para po ito sa older stage of infancy and toddlerhood from 6 months to 2 years old. Yan. So, dito nag-introduce na tayo ng complementary feeding o dagdag nutrisyon para sa mga bata. Yan. So, ano nga po ba yung first 1,000 days of life? Ang first 1,000 days of life, ito ang tinatawag nating golden window of opportunity. Yan. So, bakit nga ba ito golden window of opportunity? Dahil ito po yung oportunidad na binibigay sa atin na para maging masigla, malakas at healthy po yung ating baby. Yan. So, ang iniiwasan po natin dito, yung pagkakaroon ng mababang timbang para sa kanyang height o yung wasting po natin. Stunting, kakulangan po ng kanyang tangkad para sa kanyang edad. Underweight, kakulangan ng timbang para sa kanyang age. Or overweight po or obesity. Yung kanyang timbang para naman po sa kanyang edad. Yan. So, meron din po tayo ngayon na kinakaharap na malnutrition o tinatawag po natin double burden of malnutrition. Yan. So, pwede po tayo ditong magkaroon ng stunting at the same time overweight or obesity. So, ito po yung iniiwasan natin dahil ito ay tinatawag natin irreversible. Hindi na natin ito maibabalik paglagpas ng 2 taon. Yan. So, kaya kinukuha natin tong oportunidad na ito na mabigyan natin ng tamang nutrisyon yung mga anak po natin. Yan. So, kaya simula pa lang sa pagbubuntis, dapat inaalagaan na natin yung mga mami natin. Yan. So, hindi lang, kagaya po dun sa tema natin, hindi lang po mag-isa si mami na kailangan sa kanyang journey. Kailangan katuwang niya yung kanyang partner, kanyang mister. Yan. So, katuwang din niya ang gobyerno, katuwang din po niya ang kanyang mga kasamahan sa komunidad. Yan. So, breastfeeding check. Breastfeeding check, tama, sapat at eksklusibo. Paano nga ba natin masasabing tama ang ating breastfeeding? Dapat ito ay sinisimulan ng pagpapasuso sa unang oras na pagpanganak lang ng sanggol. Kailangan panatilihin nating nakalapat ang sanggol sa dibdib ng kanyang mami. Yan. So, pangalawa, ano po ba yung sapat? Sapat na po ang gatas ni mami para sa kanyang sanggol. Yan. So, kailangan po ito ay eksklusibo. Paano natin masasabi na eksklusibo? Ang gatas ng ina ay sapat na pagkain na ni baby natin. So, hindi na po niya kailangan ng inuming tubig o dagdag nutrisyon. Paglagpas po ng 6 na buwan, yan, so start ng 6 months, kailangan po, doon na tayo magdadagdag na complementary feeding or dagdag nutrition sa ating mga baby. Yan. So, tulong-tulong sa pagpapasuso sa first 1,000 days. Yan. So, katuwang po ng Department of Health, National Nutrition Council, City Government of Navotas, Navotas City Hospital, and Navotas City Nutrition Office ay sumusuporta po sa Breastfeeding Awareness Month. Yan. So, ang best practices po namin sa City Government of Navotas, yan. So, meron po kami mga programa na makakatulong po sa mga breastfeeding mothers po natin. Una na po dito ang Navotas First 1,000 Days of Life program or N1KD program po namin at Navotas Breastfeeding Support Group. Ang ilan po sa mga ginagawa ng ating N1KD and Breastfeeding Support Group members po natin, unang-una po, sa N1KD po natin na nagbibigay po sila ng vitamin supplementation, hindi lang po para sa mga buntis, pati rin po sa mga baby din po natin. Una, nagbibigay tayo sa mga sa mga pregnant mothers natin ng iron supplement, iron and folic. Yan. So, syempre, kahit na panahon po ng pandemya, kailangan po natin magbigay ng vitamins. Yan. So, meron din po tayong nutrition education kung saan tinuturo po ang kahalagaan o importansya po ng breastfeeding. Yan. Ito ay sinasagawa po ng mga N1KD coordinators po namin and breastfeeding members po namin. Yan. So, sa breastfeeding support group po namin, bawat barangay po ay meron kaming mga train na pwede pong makatulong sa mga breastfeeding mothers po natin. Yan. So, kung meron po tayong mga problema katulad ng nabanggit po kanina ni Doc, na meron pong kakulangan ng kakayahan magpadede or magpasuso. Nagkakaroon po kami dito ng relactation massage. Yan. So, medyo natigil lang po yung relactation massage dahil skin-to-skin contact po ito. Yan. So, meron din po kami mga videos kung paano po ba ito may sasagawa. Yan. So, ito ay sinasagawa po ng N1KD coordinator po namin and breastfeeding support group. Yan. So, katuwang din po ng mga BNS, N1KD and BHW ng City Government of Navotas. Yan. So, nagkakaroon po kami ng immunization para po sa mga bata po sa amin dito. Yan. So, milk letting activity, ito po ay sinasagawa tuwing buwan ng Agosto. Yan. So, nagkakaroon po, iniimbitahan po namin ang mga breastfeeding mothers na nakakapag-produce ng mas marami pang gatas. Yan. So, maliban po sa wet nursing na nabanggit po ni Doc Sel kanina. Yan. So, ito po, merong milk letting activity ang Navotas in partnership po with other LGU. Yan. So, nag-i-start po kami ng mga breast milk. Yan. So, sa ngayon po, natigil lang po ito dahil sa panahon ng pandemya. Yan. So, meron po tayong 10 commandments. Yan. So, sa 10 commandments, ito po ay nagmula sa 2012 National Nutritional Guidelines for Filipinos. Pangalawa po dito sa 10 commandments natin, sa unang 6 na buwan ni baby, breastfeeding lamang o exclusive breastfeeding, and magmula sa 6 na buwan, dapat bigyan na siya ng dagdag nutrisyon or complementary feeding. Yan. So, ito po ay galing sa National Nutrition Council and Department of Health. Yan. So, meron po tayong, sa mga mommies po natin, meron po tayong pwede maging guide kung paano ba natin makukuha yung tamang nutrisyon natin from breastfeeding, from pregnant and lactating mothers po natin. Pinggang Pinoy ay katuwang po para sa healthy food plate nating mga Filipino adults. Ito po ay nagmula sa Department of Science and Technology, Food and Nutrition Research Institute. Yan. So, kung mapapansin po natin, bakit po pinggan ang ginamit natin dito? Dahil tuwing kumakain po tayong mga Pilipino, ang unang-unang nakikita natin sa ating hapag-kainan ay yung pinggan. Yan. So, yung pinggan po natin na ito ay hinati natin sa 3. Kalahati po ay para sa ating globos o ito po yung ating prutas at gulay. Dito po manggagaling yung ating mga vitamina at saka mineral. Yung kalahati naman po ay hinati natin sa 2. Ito po yung ating Go Food and yung Grow Food. Yung Go Foods po, mas malaki po siya ng konti kumpara dun sa ating grow foods. Yung grow foods naman po natin, dito po tayo makakuha ng mga protina. Siyempre, kailangan pa rin po natin ng inuming tubig. Yan. So, go foods. Yung go foods po natin, ito yung nagbibigay enerhiya sa atin. Makakuha po tayo nito. Ang mapagkukunan po natin ito, yung mga kanin, tinapay, oats, cereals, pasta. Yan, para suportahan po yung bodily functions po natin and physical activity po natin. Ito yung main source ng energy po nating lahat. Yan, so mas maganda po na piliin natin dito yung mga whole grains like yung mga brown rice, corn, whole wheat bread. Yan, so ito po ay nakakatulong o makakatulong sa atin para mapababa po yung mga heart diseases natin, diabetes, and other health problems. Ito, ang pinggang Pinoy po ay para lamang po sa mga healthy pregnant and healthy lactating mothers. Kung meron po tayong uh, mga health problems katulad po ng hypertension, diabetes, pwede po tayong kumonsulta sa mga medical specialist po natin para sa mga pregnant and lactating po. Yan. So, yung glow foods naman po natin, ito yung ating mga body regulating o tumutulong po para mas lumakas po yung ating resistensya. Yan. So, a wide variety of fruits and vegetables. Yan. So, prutas at gulay dahil ito po ay naglalaman ng iron, folate na kailangan po ng mga pregnant natin. Yan. So, hindi lang po for pregnant ito. Kailangan din po mas marami yung gulay natin para mas maganda dito, iba't ibang klase po ng pagkain yung kakainin natin or iba't ibang klase ng prutas at gulay yung kakainin natin para iba't ibang nutrition o nutrients yung pumasok sa katawan natin. Yung grow foods naman po natin, ito yung ating bodybuilding. Makakuha po tayo nito o mapagkukunan natin nito ay yung mga isda, shellfish, o yung mga karne. Baboy, manok, isda, itlog, toko, and tofu, kasama po dito yung ating gatas. Yan. So, kailangan po mag-consume tayo ng milk and milk products, lalo na po sa mga pregnant and lactating mothers po natin. Yan. So, kailangan po uminom din tayo ng maraming tubig. Yan. So, lilimatahan po natin yung pag-inom o pagkain ng mga matatamis, maaalat at mamantikang pagkain. Yan. So, kailangan pa rin po natin ng balanse. Kailangan hindi po sobra, hindi kulang. Kailangan balance lang po yung ating diet. Yan. So, kailangan variety. Iba't ibang klase po ng pagkain yung kakainin natin para iba't ibang nutrition din po yung papasok sa katawan natin. Kailangan po natin magkaroon ng limitasyon o moderation sa mga kinakain po natin, lalo na mga mamantika, maalat, tsaka matatamis sa pagkain. Ito po ay katumbas ng ating healthy diet. Yan. So, ano po ba yung mga makakatulong sa ating breastfeeding? So, ano ko lang po. Yan. So, 5 fun facts about breastfeeding. Una, yung katawan po ng ating mga mami ay ready na po kaagad once na maisilang na po natin yung baby natin. Ang unang-una po na lumalabas na gata sa atin, ito po yung malapot, medyo yellowish. Yan, ito po yung tinatawag natin na colostrum. Kahit sa konting amount lang po nito, marami na pong masustansya o marami ng nutrisyon na makukuha yung ating mga baby dito. During breastfeeding, si mami at si baby ay nagpo-produce ng oxytocin. Ito po yung hormones na nakatulong para bumaba yung stress and anxiety ni mami and ni baby. Yan. So, connected na po kaagad silang dalawa. Sa breastfeeding supports the development of healthy guts. Yan. So, hindi lang para ito kay mami. Yan. So, para din kay baby, maging healthy yung kanyang digestive bacteria. Yan. So, breast milk, itong yung kagaya po ng nabanggit nila doktora kanina. Yan. So, yung breast milk po ay nagko-contain ng mga antibodies na makakatulong para tumaas yung immune system ng ating mga baby. Yan. So, yung mga baby po natin usually pinapakain or pinapadede po natin first few days. Yan. So, makakatulong po ito para yung mga baby natin ay mas mabilis yung milk ni mami mas mabilis yung makapag-produce ng mas marami. Yan. So, yan ako lang medyo Mababa yung sa akin. Yan. So, yung sa breast milk po ni Mami, pwede po natin i-continue ito. As long as meron pa rin nutrisyon na makukuha dito yung baby natin. So, pagdating nga lang po ng 6 na buwan, kailangan meron na tayong dagdag nutrition dahil hindi na po sasapat yung nutrition o yung nutrients na nakukuha ng ating baby. So, kailangan meron pa rin tayong spare or pandagdag nutrition ng mga baby natin. Babies who breastfeed into the second year and beyond are less likely to become overweight. So may iwasan po natin dito maging overweight or obese yung ating mga baby. Breastfeeding help your baby fights of infection and builds stronger immune system. Yan, breastfeeding is good for mothers too. Nakakatulong ito para mapababa ang risk magkaroon ng breast and ovarian cancer si mami at type 2 diabetes and cardiovascular diseases. The longer you breastfeed, the more these risks are reduced. Yan. So, mas mapapababa po natin ito. Base po ito sa World Health Organization. Yan. So, ano po ba yung 10 good things na kailangan natin malaman sa exclusive breastfeeding? Yan. Sa unang-una, nakakatulong ito para mailigtas yung buhay ng ating baby dahil meron itong antibacterial agent. Pangalawa, nagpo-provide ito ng nutrisyon na kailangan ng ating mga baby for the first 6 months or exclusive breastfeeding. Na-ensure nito na malinis at safe yung pagkukuha ng pagkain ng ating mga baby, especially in emergencies. Yan, so katulad po ng panahon ng pandemya, hindi natin mas secure na safe yung mga makakain ng baby natin. So, kung bottle fed po ito, pwede po tayo pwedeng makontamina ito sa paghuhugas kung hindi tama yung paghuhugas at syempre yung ano natin, yung pinagkukunan ng mga pagkain. Yan, so makes child grow strong, intelligent. Yan. So meron ding DHA at iba pang nutrisyon na makukuha sa breast milk ni mami. Yan. So break the cycle of diarrhea and malnutrition. Yan. So, katulad po ng nabanggit ko kanina, yan. So possible po sa contamination yung mga bottle feeding. Yan. So nagkakaroon pa po ng bonding between mother and child. Yon. So nagpo-produce nga po ng oxytocin para mabawasan yung matanggal yung stress and anxiety ni mommy and yung baby. Yan. Pinabababa po nito ang tsansa na magkaroon ng ovarian cancer and breast cancer si mami. Nakakatulong din ito sa space pregnancies, natural method ng birth control. Yan. So yung tinatawag po nating lactation amenorrhea method. Yan. So, syempre, pinaka-pangsyam. Ito po yung pinaka-gusto nating lahat. Nakakatulong ito para makapag-save ng money natin. Dahil syempre, alam naman po natin na may kamahalan po ang mga formula milk natin. Yan. So, libre, tama, sapat at eksklusibo pa yung ating may bibigay sa mga anak natin. Yan. So, syempre, nakakatulong din ito para protektahan ng ating environment. So, yan. So, essential newborn care, a simple, cost-effective newborn care intervention that can improve neonatal as well as maternal care. Ito po yung tinatawag natin na unang yakap. Yakap ng ina, yakap ng buhay. Unang yakap stimulates breathing and keeps baby warm, calm, and healthy. Ano po ba yung 4 core steps nito? Yan. So, kagaya po na nababanggit kanina na doktora. Yan. So, immediately and thorough drying, early skin-to-skin contact. Yan. So, para makapag-produce ng oxytocin, properly timed cord clamping, non-separation of newborn from mother for early breastfeeding. Yan. So, takeaway message po, breastfeeding is a mother's gift to herself, her baby, and to the earth. Yan. So, ito po yung pinakamagandang regalo na may bibigay natin sa mga anak natin and sa mundo. Yan. So, good nutrition creates health in all areas of our existence. All parts are interconnected. Yan. So, by the way, I'm Florito Biduya from Nabota City Nutrition Office. You can also follow us on our FB page, Nabota City Nutrition Office, and you can watch our mga lectures, in YouTube na Botas Nutrition. And that's all. Thank you.
Maraming salamat, Sir Florito Beduya. So, after listening to our resource speakers, we presume that everyone is aware of the importance and the benefits of breastfeeding. Let us all keep in mind that breast milk is the recommended, ideal, natural, and most sustainable food for the healthy growth and development of infants and young children. Alam din natin na kahit ang coronavirus, hindi mapipigilan ang breastfeeding. So we expect that each one of us is now ready to accept the responsibility to protect, promote, and support breastfeeding. So that ends our activity. Have a good day and stay safe, everyone.